Hello guys, I welcome you all for e-learning course of pharmaceutical chemistry for chapter Radiopharmaceuticals and Contrast Media part 3. In earlier session we had discussed about background of radiopharmaceuticals and its handling also. Okay, in this session today we will learn about examples of radioactive materials along with its uses, applications in medical area. Let's see one by one. First example is sodium iodide, abbreviated as I-131, that is radioactive element, okay, from iodine. It is used as diagnostic aid. We all know what is meant by diagnosis. Diagnosis means detection of any disease and not the treatment, okay, for studying the functioning of thyroid gland. If thyroid gland is not functioning properly, that time occurs hyperthyroidism or hypothyroidism. What is hyperthyroidism? Overactive thyroid occurs when your thyroid gland produces too much of hormone thyroxine. And what is meant by hypothyroidism? Uh, it is occurred when your thyroid gland produces less of hormone thyroxine. So, for that detection of hyper and hypo states, we use this sodium iodide radioactive element. Okay. Another one example, it is used in scanning the thyroid for determining its size, position, and possible tumor location. In pictorials, in below pictorials, I have shown you how radioactive iodine is ingested, and after ingestion of that radioactive element will able to see the location of thyroid in our neck. Okay, gamma probe measuring thyroid gland radioactivity. Next, it is used in treatment of severe cardiac disease. What is meant by cardiac diseases? Cardiac means what? It is related with heart diseases. It reduces workload on heart. Okay, next, radioactive iodine in thyroid carcinoma means cancer. The isotope is used most frequently after the surgical removal of cancer of that particular area to treat any residual tumor if remaining over that tissue. Okay, next we'll see briefly. It is suitable for oral route also. It contains sodium thiosulfate as a reducing agent. Okay, it is clear colorless solution, and T half, that is half life period of this radioactive element is 8.04 days. Okay, and storage, it is stored in amber colored glass stoppered bottle in dry place. Why is iodine 131 used for the thyroid gland? The question also came in my mind, and the answer I find is when a thyroid gland is overactive, it produces too much of these hormones, accelerating the metabolism, right? Radioactive iodine I-31, an isotope of iodine that emits radiation, is used for medical purpose. Radioactive iodine 131 may also be used to treat thyroid cancer. Okay, the mechanism of action of radioactive iodine is physiological. Iodine is the precursor of thyroxine, right? The radioactive form of iodine is taken up by iodide transporter of the thyroid the same way as natural iodine in our body, and is similarly processed. Okay, then particles destroy the follicular cells, gradually leading to volume reduction and control of thyrotoxicosis. Okay, this is the mechanism of RAI, that is radioactive iodine. We'll see one by one its uses. First use, to study iodine uptake by the thyroid gland. Okay, by using this solution we will study iodine uptake by thyroid gland. We already studied the mechanism of how radioactive iodine, right? Nextly, we'll see next example for diagnosis of hyperthyroidism and hypothyroidism, used in scans to take pictures of the thyroid or thyroid scan, or to take pictures of the whole body to look for thyroid cancer, whole body scan. Hyperthyroidism, a condition where the thyroid gland is overactive and produces too much of thyroid hormone. How radioactive iodine works? This plays a valuable role in diagnosing and diagnosing and treating thyroid problems, since it is taken up only by the thyroid gland, only and only thyroid gland. It is very specific one. I-131, that is radioactive iodine, is the destructive form used to destroy only thyroid tissues in the treatment of thyroid cancer and not other tissues, surrounding tissues to thyroid gland. Okay, and with an overactive thyroid, I-123 is the non-destructive form that does not damage the thyroid and is used in scans to take pictures of the thyroid. This is called as thyroid scan, or to take pictures of the whole body to look for thyroid cancer. This is known as whole body scan. Okay. Third use, in the treatment of carcinoma of thyroid and thyrotoxicosis. What is meant by thyrotoxicosis? Toxicosis is toxic type of goiter. Okay, the swelling of neck. Next. Okay, the next example is iron 59, ferrous 59, right? Iron 59 is a beta and gamma emitting isotope. It is used in diagnosis to study the iron metabolism and to study the red blood cell formation. As we all know, RBCs are related with formation of heme or iron metabolism, right? As we know, in anemic conditions there is deficiency arises in formation of RBCs. So by using this we can study the anemic conditions, anemia. Okay, the preparation is administered orally for studying the absorption of iron from gastrointestinal tract. Okay, administered intravenously to study incorporation of iron in formation of RBCs. Okay, it is also used to study the formation and destruction of spleen, liver, etc. from outside the body. Next, we'll see various applications of radioisotopes. They find use in medicine in 4 different ways. First way, by radioisotopes in therapy, directly treatment. Secondly, radioisotopes in diagnosis. Diagnosis means only detection purpose. Third one, research, in research methodologies. Fourth one, sterilization. Okay, by sterilization means what? Removal of any microorganisms, right? We'll see one by one. First, radioisotopes in therapy. Immediate radiations used to destroy cells in conditions like cancer. So directly will treat here cancer. So used as therapy. Okay, next, radioisotopes in diagnosis. Diagnosis means detection. Radioactive tracers we used for detection of any kind of disease. Okay, third one is research. Biological and medicinal studies by use of radioactive isotopes as tracer molecules. Okay, next, sterilization, very important. For sterilization of pharmaceuticals and surgical instruments, these radioactive elements are used. These are very cost effective and cheap. Okay, and it finds very wide use for sterilization. By using this radiation we can sterilize equipments very easily. Next, diagnostic application. We'll see here briefly how diagnostic applications. Radiopharmaceuticals are developed based on ADME. What is ADME? Absorption, distribution, metabolism, excretion properties of the body. Okay, so radiopharmaceuticals are developed. How they developed? We firstly study ADME, and then based upon that ADME properties we will develop the radiopharmaceuticals. Okay, by administering a radiopharmaceutical to a patient, images of targeted site can be produced by a gamma camera, because gamma rays are having very greater penetration ability. The images can then be analyzed by using the nuclear medicine doctor to detect any medical problems. Okay, by analyzing the captured images we can detect any medical problem or its altered physiology or anatomy. Radiopharmaceuticals are most widely used to detect various forms of cancers. Depending on the site for diagnosis, there is a specified route of administration. Okay, there are various routes of administration depending upon its site for diagnosis. Second, therapeutic use of radiopharmaceuticals. In directly therapy or treatment of disease, how radiopharmaceuticals are used, we'll see. Radioactivity can be used in medicine and pharmacy in different areas, very wide areas. The first being radiology, in which an external source of radioactivity passes through a patient and radiation is absorbed by more dense tissues. Okay, there is very much problems arises by absorption by more dense tissues and not by less dense tissues, and an image is ultimately formed. The second is radiation therapy, which treats for tumors or cancerous cells using an external source of radiation to try and abort a tumor. This requires a lot of radiation in very high doses. Okay, it requires very high dose of radiation. Nuclear medicine uses an internal source of radiation to be detected externally, unlike the two previously mentioned. Okay, a patient is injected with a radiopharmaceutical material which has a radioactive component that decays means what, decomposition, and a pharmaceutical component which takes it a desired organ, okay, at that desired position. Radiopharmaceuticals can be used to destroy malfunctioning cells. If cells starts malfunctioning, that time we can use radiopharmaceutical to kill that particular malfunctioning cells. This method of therapy is called radiotherapy. It can be used for both benign and malignant cancers. In order to destroy the diseased tissue, a radionuclide has to emit beta, alpha, or low energy conversion electron emitters. Beta radiation is effective for large tumors and alpha radiation is effective for smaller tumors. This thing you have to keep in your mind, that beta radiation is effective for large tumors and alpha radiation is effective for smaller tumors. Okay. Next, we'll see one example. Gold 198 AU is used in treatment of abdominal and pleural effusions associated with malignant tumors. It is given in the form of colloidal gold suspension. When cancer grows in pleural space, it causes a malignant pleural effusion. This condition is a sign that a cancer has spread or metastasized to the area. Okay, gold 198 AU also used in treatment of carcinoma of uterus and urinary bladder. What is carcinoma then? Carcinoma is a type of cancer that starts in cells that make up the skin or the tissue lining organs, such as the liver or kidneys. Like other types of cancer, carcinomas are abdominal cells that divide without control. They are able to spread to other parts of the body also, but don't always. Okay, not all cancers are carcinomas of the body. Common cause of malignant pleural effusion are lymphoma and cancers of breast, lung, and ovary. Okay. Third, cobalt labeled cyanocobalamin, that is vitamin B12, is used in diagnosis of pernicious anemia. Okay. Then what is meant by pernicious anemia? Pernicious anemia is deficiency in red blood cells caused by lack of vitamin B12 in blood. Okay, it is arises due to lack of vitamin B12 in blood. Pernicious anemia is defined as type of vitamin B12 deficiency that results from impaired uptake of vitamin B12 due to the lack of substance known as intrinsic factor, that is IF, produced by the stomach lining. Here also we use radioactive cobalt, okay, or cobalt labeled cyanocobalamine. Next, sodium iodide preparations find use in treatment of thyroid diseases. As in earlier slide, we had briefly discussed this use of sodium iodide in treatment of thyroid disorders. So we skip this point over here. Next, calcium is used to study bone structure and in carcinoma of bone. Next, strontium 90 is used in diagnosis of superficial carcinomas. Okay. Next, radioisotopes may be used internally or externally, both ways. Okay, not only internally, not only externally, it can be used by both ways. If the radioisotope are used externally or used as implants in sealed capsule in a tissue, the dose could be terminated by removal of sources. Okay, we can stop this dose at any time, but if it is used as unsealed sources, the dose cannot be stopped by the removal of source. Okay, this is very important point, guys. If the radioisotopes are used externally or used as implants in sealed capsules, okay, not in it is sealed capsules in a tissue, then the dose could be terminated or stopped by removal of source material. Okay, but if they are given internally as unsealed sources, not sealed, unsealed sources, then the dose cannot be stopped or terminated by the removal of source. Okay, next, the total dose in therapeutic applications may be calculated on the basis of effective half-life of isotope. Okay, concentration of isotope and the type and energy of radiation emitted. Next, in therapeutics, okay, we will discuss applications of radioactive material. First, in therapeutics, okay, radiation therapy. We all know what is meant by radiation therapy. Okay, therapeutically used radioisotopes have been found to depend mainly on their ability to ionize atoms. The energy measurement involved in radiation and resulting in ionization may be expressed in millions of electron volts, called MeV. The strength of alpha, beta and gamma rays is expressed in MeV. All radiations brings about ionization of atoms in their paths. The radiation of short wavelength, that is gamma rays, is having high penetrability or high penetration power than long wavelengths. Example, beta rays. Okay, the greater the MeV of the rays, the more destructive it becomes to the surrounding tissues, and vice versa cases. Radiopharmaceuticals can destroy malfunctioning cells also. This method of the therapy is called as radiotherapy. It can be used for both benign and malignant cancers. Now let us take a look on radiation therapy. Okay, radiation therapy means what, and what is meant by radiotherapy. Okay, so radiotherapy means a cancer treatment that uses high doses of radiation to kill cancer cells and shrink tumors. For shrinking tumors, at low doses, radiation is used in X-rays to see inside your body, as like camera, as with X-rays of your teeth or broken bones. Radiation therapy is a treatment for cancer and less commonly thyroid disease, blood disorders and non-cancerous growths. A doctor may recommend radiation for cancer at different stages. Okay, in the early stages, radiation therapy can help to reduce the size of tumor before surgery or kill remaining cancer cells afterwards. But it is also having some disadvantages. The disadvantage of radiation therapy include damage to surrounding tissues also, example lung and heart, depending on how close the area of interest is located to the tumor. Okay, next, radioisotopes may be used internally or externally. If the radioisotopes are used externally or used as implants in sealed capsules in the tissues, the dose could be terminated by removal of sources. We have seen earlier applications of radiopharmaceuticals treatment of disease. First, therapeutic radiopharmaceuticals. They are radiolabeled molecules designed to deliver therapeutic doses of ionizing radiation to specific diseased site. Chromic phosphate P32 for lung, ovarian, uterine and prostate cancer. Sodium iodide I-131 for thyroid cancer. Samarium, that is SM 153 for cancerous bone tissue. Sodium phosphate that is P32 for cancerous bone tissues and other types of cancers. Okay, in diagnosis. Okay, this is second use. Radioactive traces find use in medicine for diagnostic purposes, for detection. Okay, labeled cyanocobalamin finds use for measuring the glomerular filtration rate, kidney functioning. Okay, second, ferric citrate injection finds use for the diagnosis of hematological disorders. Means what is meant by hematological? It is related with blood disorders. Okay, colloidal gold injection is used diagnostically to study blood circulation in liver. Okay, if there is blockage or not, likewise, right? Next, sodium iodide injection finds use in diagnosis of proper functioning of thyroid gland. Okay, next, fifth use, sodium iodohypurate injection finds use in the study of renal function. Renal means kidney functioning. Okay, sodium finds use in renal functioning. Next, sodium rose bengal injection finds use as diagnostic agent to test liver function. Liver function test can be used to screen for all liver infections such as hepatitis, monitor the progressive of disease such as viral or alcoholic hepatitis, and determining how well a treatment is working, measure the severity of disease, particularly scaring the liver. Okay, next, third, in research. Okay, excellent biological and medicinal studies have been carried out with radioactive isotopes as tracers. In medicine, two of most commonly used radioisotopes are used: technetium 99M and iodine 131. Radioactive isotopes are also used for medical research to study normal and abnormal functioning of organs and systems. Okay, and last use is sterilization. Excellent use is being made of the radiation constantly available from some strong radiation source for sterilizing pharmaceuticals in their final packed containers and surgical instruments in hospitals. No heat or chemical get involved. Thermolabile substances like vitamins, hormones, antibiotics can be safely sterilized and finds use in sterilization of various pharmaceutical materials. According to the NRC, some of the most commonly used tracers include antimony 124, bromine 82, also iodine 125, iodine 131, iridium 192, and scarandium 46. Many medical products today were sterilized by gamma rays from CO60 source. Okay, a technique which generally is much cheaper and more effective than steam heat sterilization. The disposable syringe is an example of product sterilized by gamma rays because it is a cold process, right? Cold process radiation can be used to sterilize a range of heat sensitive items such as powders, ointments, and solutions, as well as biological preparations such as bone, nerve, and skin to be used in skin graftings, okay, or tissue grafting. Sterilization by radiation has several benefits. It is safer and cheaper because it can be done after the item is packed. The sterile shelf life of the item is then practically indefinite provided the seal is not broken. Apart from syringes, medical products sterilized by radiation include cotton wool, burn dressings, surgical gloves, heart valves, bandages, plastics, and rubber sheets, and surgical instruments also sterilized by using this technique. Okay. Next, these are some materials. Calcium, it is Ca44 and Ca45, are the radioactive forms of calcium. The radioactive calcium has been used to study bone structure and in treatment of carcinoma of bone. Next, strontium 90, it is used in the radiotherapy of superficial carcinomas. Next, cyanocobalamin CO57, it is used in the diagnosis of pernicious anemia. Next, calcium 47 it is having half-life of 4.7 days. It is used in calcium absorption studies. Next, cyanocobalamin CO60 solution USP, United States Pharmacopoeia. It is used to study absorption and deposition of vitamin B12 in normal individuals. Next example, gold U198 solution finds used in estimation of reticuloendothelial activity. Okay, next and last is iron, that is Fe, ferrous 59 finds use in research studies about utilization and absorption of iron salts. Okay, so we have finished today's session. In today's session we had discussed a lot of points. We'll firstly discussed regarding various radioactive compounds, its uses. After that we had discussed its applications in medical field also. In next part we'll discuss about its